So basically, Joe, what do you think about this whole thing about bringing heart awareness to the schools?
I think it's I've never heard of it before, first of all, and I think that Dr. Kavesteen is just extraordinary in his generosity. To come here, I took advantage of it myself. Not many of us have a cardiologist. Unfortunately, the need for a cardiologist will occur after you've had a problem. So this is a wonderful way of getting in front of that, preventing it. And you could be treating things in a different way before, God forbid, there's any damage to the heart, and then you're going to need a cardiologist. So, I find this, again, it's the first time I've ever heard of this anywhere. I think that Dr. Kavesteen is a unique healer, and I thank him very much for coming to Kamsawak today and allowing us to take advantage of his talents and his generosity today.
So what's one of the reasons that you did a heart screening for the school district?
As a physician, one of the reasons I went to medical school and committed myself to this lifestyle of being a physician was to help the community. And unfortunately, with all the restrictions that's happening and restrictions on the insurance coverage, I feel that the relationship between the physicians and community has been deteriorating. My goal is by going to the public places, schools, churches, or other communities, I can facilitate and this trust that has always been between the doctors and the community and patients. I believe this relationship is a sacred relationship, and my goal is to cherish this and improve it.
Do you think everybody should have a cardiologist?
No, I don't think everybody needs to have a cardiologist. I believe that everyone needs to be educated about heart disease and prevention. I believe that in our lifetime, with the new technology, it's easy to detect the disease before the disease actually blooms. It's a lot easier to prevent a heart attack rather than treat a heart attack 3 o'clock in the morning by going to an emergency room and hoping you get the right doctor and the right place. And the most common cause of death in a young adult, about mid-age, 40 to 60, is heart attack and heart disease. And if I can save a life and if I can educate people to prevent the disease, I have done my duties and I have reached my goal.
So, Joe, what do you think about having this heart screening here at the Kamsawak High School for the people and the employees of the district?
It's pretty incredible to have someone with that amount of knowledge as far as a cardiologist to come in and offer something for free to people that sometimes you take for granted your health, and you don't always take the time to take a step back and look at it and saying, am I okay, or are things good? And all along I exercise on a daily basis. I eat pretty well, and coming in here, you look at it and you say, oh wow, this is realistic for me now, and I see some of the changes that I need to make, and it's extremely generous for someone to volunteer their time and just come in here and do what they're doing to ensure that this community is healthy.
And what about the rest of your staff and teachers? Don't you you want to make sure that they're alive and kicking for a while?
I do. I'd like to keep everybody here around for a long time. We have some great teachers here, so hopefully they'll all take advantage of this like I did. And hopefully because I did, I'll stick around a little bit longer myself.
This is a certificate of appreciation to Dr. David Kavesteen, and it's awarded for outstanding service and contributions to the health and wellness of the Kamsawak community through his extraordinary generosity.
Thank you very much. Thank you so much. My pleasure. Thank you so much.
Please feel free to visit our website at heartandhealth.com. Heart and Health is a multi-specialty care facility in family medicine and cardiology, specializing in latest technologies in detection of early stage of diabetes and heart disease, in 2 locations in the heart of Long Island, Babylon and Middle Island.